Good afternoon, everyone. My name is Blu Mackey, and today I'm going to be going over my research on the foster care system and how it's a segue to sex trafficking. This literature review was conducted by me along with the help of my faculty mentor, Dr. Jeff Dudal from the University of Oregon. My introduction gives an overview of how sex trafficking is a prevalent and persistent human rights, social justice, and economic issue. Fueled by a multi-million-dollar industry, this global epidemic is complex and compounded by poorly resourced government and private sector response systems. The U.S. foster care system serves homeless youths at risk for sex trafficking, but is not well positioned to provide trauma-informed services that support youth and act as a buffer for future harm. Given the overall poor systems alignment and inadequate access to trauma-informed therapy and healthcare services, foster youth are particularly vulnerable to trafficking, and this disproportionately impacts our lower-income, historically excluded youth. Although it seems as if sex trafficking is an issue that concerns every population, regardless of socioeconomic status, research has shown that our foster care populations prove to be disproportionately at risk and victimized. The methods I used for this literature review were absorbed from methods by Pettigrew and Roberts and draws on research conducted within the last 23 years, with a focus on girls within this commercially sexually exploited foster youth population. Keywords were adapted to focus on database publications that used qualitative methods and technical reports that specifically addressed the research questions. Technical reports were selected from either peer-reviewed publications or reports produced by widely accepted discipline leaders, organizations that dedicate their time to fighting the sex trafficking industry, and government-published resources. Our research questions were based on foster care reform, and addressing the issues within sex trafficking that may have contributed to its prevalence. These questions consist of what current child welfare system practices are negatively impacting child development and contributing to the risk of sex trafficking for foster care youth? What child welfare system reforms and strategies may best reduce sex trafficking risk and improve outcomes for foster care youth? What are the most effective policies and practices within the child welfare system that will ensure the success and healthy development of these youths in the future? Based on my research, I noticed that a quote by Withelma Ortiz Walker Pettigrew, a youth survivor, said that youth within the system are more vulnerable to becoming sexually exploited because youth accept and normalize the experience of being used as an object for financial gain by people who were supposed to care for us. With the continuous prevalence of sex trafficking, I noticed that we would be able to tackle this massive adversary by sustaining trauma awareness, building knowledge and skills in the organizational cultures, practices, and policies in the child welfare system. Furthermore, by implementing strategies to improve the living environments and placements and employing empathetic, patient, and trauma-informed specialists, our systems are then better positioned to prevent future re-victimization. Reforms and legislation outlined in this review offer for promise for comprehensive resources and support throughout their foster care journey into emerging adulthood as a way to disrupt the too much familiar segue from foster care to sex trafficking, to facilitate recovery and build pathways towards thriving childhoods. The references I used for both my manuscript and poster will be attached to this QR code. Thank you very much.